This meeting is being recorded.
A very good evening to all of you. Myself, Dr. Jamuna, heading Clinical Excellence and Research Team at Qurhealth. I would like to welcome you all for a thought-provoking session on staying healthy during pandemic and importance of regular health checkups. We have our esteemed panel of speakers for today, Dr. Rajesh Shavi, Dr. Janaki Badagu, and Dr. Sunil S. A warm welcome to you, doctors. For those who do not know about our company, Qurhealth, I would like to give a brief introduction. At Qurhealth, our vision is to save lives super proactively. Our company has developed QureBook app with more than 1,500 care plans and diet plans under 30 plus health categories. We have Sheila feature in the app who acts as AI-based healthcare assistant. And she can record your vitals, symptoms, activities, and also answer to your questions related to different health conditions. Under Cure1 Care Coordination Service, we have highly trained nurses who act as care coordinators. They will remotely monitor your health condition through regular follow-up calls and make sure that you adhere to your care plan activities, take your medication on time, and eat healthy food which is listed in your diet plan. Before we start, I would like to introduce to you all our speakers for today. To begin with, let me introduce to you all to Dr. Rajesh Shavi. He has more than 31 years of experience as senior consultant physician and diabetologist. He practices at Sri Sai Ram Hospital, Mamata Hospital, and Venkateshwara Specialty Hospital in Bangalore. He is a member of Indian Medical Association and Karnataka Medical Council. Some of the services provided by Dr. Rajesh are fever treatment, viral fever treatment, health checkups, COVID treatment, and diabetes management. We are honored to have you with us today, doctor. We also have our very famous dietitian and nutritionist, Dr. Janaki Badagu. She has more than 25 years of experience and she is the founder of Dieta. She has been honored with Vaidya Ratna and Bharatiya Chikitsa Ratna Award by Government of Andhra Pradesh and Telangana. Her signature program, Janaki's Diet Tips, was telecasted in major TV channels. At Dieta, Dr. Janaki has trained hundreds of students with the knowledge of diet and nutrition. Dieta also offers food management services and provides Nikkei courses to chefs and culinary professionals. Major corporate health-oriented food products like Kellogg's, Pediasure, Ajinomoto, and Nutris have been encouraged and promoted by her. Dr. Janaki has served as Vice President of Indian Dietetic Association. Thank you, Doctor, for gracing the occasion with your noble presence. We also have Dr. Sunil, who is a renowned pulmonologist with more than 13 years of experience in treating patients with all kinds of lung diseases. He has worked in critical care, Sunshine Hospital, Hyderabad. He is a member of Indian Chest Society, European Respiratory Society, and member of Medical Council of India. He has been awarded with European Diploma in Adult Respiratory Medicine. He is known for diagnosing and treating patients suffering from allergies, asthma, pneumonia, COVID, TB, COPD, etc. He is an expert in bronchoscopy and thoracoscopy. He has more than 1,500 COVID patients treated during this pandemic with almost 98% recovery rate. Thanks, Dr. Sunil, for joining us today.
Hello.
So before I start, I would like to inform all the viewers that you can type your questions in comment section. These will be answered at the end of the webinar during Q&A session. So let's begin our session with Dr. Sunil. Dr. Sunil, as a pulmonologist, you would have treated thousands of patients with lung issues during pandemic. World Health Organization states that most people affected during pandemic are older population and patients with comorbid and chronic conditions. What do you suggest these patients regarding lung health? And what are the necessary precautions they have to take?
Hello, good afternoon to all our viewers. Uh, Coming to regular health checkups, those who are in comorbid conditions and other people. So, those who have comorbidities like diabetes, hypertension, hyperthyroid, or other malignancies, lung cancers, or any other people. So, who are infected with COVID, especially, and who got moderate symptoms or severe symptoms. So there will be like pneumonia and fibrosis and all other lung comorbidities will be there. So what the regular health checkups like related to these things will be like we have to assess their lung functions like PFT, 6-minute walk test, and other their breathing capacities, how they are improving, and especially they have to go for lung health exercises like spirometries and breathing exercises like inhalations and exhalations. And regarding checkups, these comorbid people will have underlying some diabetes. There may be chances of aggravating these diabetes, hyperglycemic attacks.
Okay.
And those who have chronic kidney injury, there may be chances of their creatinine get increasing day by day. So and with myocardial infarctions, like these hypertension people have their chances of heart attacks. So they have to regularly monitor their like normal sugar levels and other inflammatory markers like CRPs and other their CBPs, their regarding whether there is anemia. So all these regular checkups we have to check. And if they have and these pandemic, they are neglecting more of their regular treatments also. They are not taking proper medication in timely manner. So what happens with COVID, there will be more aggravating factors, all these combined. So it is important to have regular health checkups. Even if they go not go into physical, at least they have to check with the parameters, and they can consult in online. Then mm,
So, doctor, what do you suggest? Like, for these comorbid and chronic condition patients, is it like mandatory only among the adult health groups or the elderly age groups?
no, actually, irrespective of age, even like elderly have more sufferings. Actually, if they have underlying comorbidities, they will be more prone to especially lung factors like lung fibrosis and recurrent pneumonias. There may be chances of post-COVID symptoms like recurrent coughs, or if they have any pre-existing allergies or asthma, there may be chances of aggravating factors like persistent cough more than 2 to 3 weeks, or breathlessness, chest pain, like post-COVID complications. We are seeing post-COVID syndrome like cough, chest pain, breathlessness, vomitings, diarrhea, muscle weakness, myalgias, muscle pains, fatigue, tiredness. So these all things will be there. Those it may be like elderly or it may be adult patients.
Okay. So, doctor, we have been reading various research articles on long-term organ damage, which is caused by COVID infection.
Yeah.
Is it only the lungs that get affected, or there are any other major organs like kidney, heart, or liver, which are being affected due to long-term health risk after COVID?
Yeah. So actually, what happens if the it depends on severity. So if the patients, whether he got mild symptoms or moderate symptoms or severe symptoms, whether he got hospitalized, whether he got hospitalized in a room settings, or whether he got hospitalized in ICU, intensive care setup, and how the severe the lung damage, whether it moderate or severe. Like in a CT scan, we can see the what we say the severity of pneumonia, whether it's mild to moderate or severe. So depends on their saturation levels, whether they are where the saturation is like above 95 or 89 to 95 or less than 80 at the time of admission. So considering we have to see these factors, because if they have severe pneumonia, the chances of like after the recovery it may take for the recovery may take at least 2 to 3 months also. And the saturations, once
Okay.
while discharging also, they will be having like oxygen requirement, home oxygen requirement. They will be discharging with 89 to 90% of saturation, requiring home oxygen concentrators. So all these very different things will be there. And this and most of them will be having like moderate to severe pneumonias. The the pneumonia will be slowly healing. Like it will take some 6 to 8 weeks, or it may take 3 months to 6 months also. So what happens, like post-COVID fibrosis, we have been seeing in these patients, like severe pneumonia patients, and there may be scar marks in the lung tissue, and they will be suffering from recurrent breathlessness, recurrent coughs, even after the recovery from COVID. So, so these all symptoms will vary depending on the situation.
Okay, okay, doctor. So let us put some light on diet and nutrition aspect. So, Dr. Janaki, since the beginning of COVID pandemic, boosting immunity has been the hot topic of discussion. Please let us all know, will boosting immunity through diet be helpful to fight or prevent COVID infections?
At the outset, I would like to thank you, Dr. Jamna, and Qurhealth team for having me on board and inviting me to this webinar today. Appreciate this opportunity given. And also a very good evening to the audience who are here. To the question, yes, with food, we can always strengthen our immunity. In this pandemic situation, challenges arise concerning how to optimally support the immune system in general population. An optimal immune response depends on an adequate diet and nutrition. I'm underlining it, adequate diet and nutrition, in order to keep infection at bay. So for example, sufficient protein intake is crucial for optimal antibody production. Likewise, a low micronutrient status such as vitamin A or zinc has been associated with increased infection. Another best example I can give is vitamin D may actually perturb viral cellular infection via interacting with cell entry receptors. So one most important and best example is the dietary fiber, which is fermented by the gut microbiota into short chain fatty acids, has also been shown to produce anti-inflammatory effects. So frequently, poor nutrition status is associated with inflammation and oxidative stress, which in turn can impact the immune system. Therefore, I can say that with a balanced diet, we can always strengthen the immune system.
So, doctor, do you think foods which are immunity boosters, they have the potential to safeguard our body against all kind of viral, bacterial, and fungal infections?
The best way to put is nutrients that strengthen the immunity will be helpful in combating infections. Yeah. Okay. There's some. Can that be muted? Hello. Yeah. So to the question, the best way to put is nutrients that strengthen immunity will be helpful in combating infections arising from virus or bacteria or fungus. Sometimes specific nutrients are required for specific type. The viral infection can be highly contagious, easily transmissible, which can even lead to a pandemic like what we are seeing right now, and of course causing massive deaths worldwide. While still the best practice way to prevent the transmission of viruses is to practice self-sanitation and follow social distancing principles, enhancing the individual's immunity through the consumption of proper foods containing balanced nutrition that can be significantly result in against a viral infection. Foods containing nutrients such as vitamins, minerals, fatty acids, a few polysaccharides, and some non-nutrients like fiber, polyphenols have shown therapeutic potential against the function of viruses and can increase the immunity of people. So at the end, I can underline again that with the food, we can definitely fight either it is virus or bacteria or fungus.
Okay. Okay, okay, doctor. So according to you, which foods do you consider as superfoods and immune boosters? Please let the audience know about the kind of regular diet they should follow to boost their immune system.
See, in my opinion, there is nothing like superfood because food itself is super. and it is
Okay.
there and it is there to nurture us at any given point of time, but only when we do it in a balanced way. First and
Yeah.
foremost is every individual must maintain balanced diet. That's the most important thing and super thing that we can do. From balanced diet, we do get all nutrients that are required to maintain optimal health. Now, considering pandemic, I would recommend certain points to you. First is gut health, which is very important because that is where the immune cells we produce from the gut every day. So we need to maintain good microbiome in the digestive system in order to produce immune cells and reduce the inflammatory agents. Fiber and polyphenols are important. So what you have to look at is your spice box. Spices are very rich in polyphenols. Now you understand why the kada or kashayam and all those things have become
Yeah.
so famous during pandemic. No, so
Yeah.
they act through polyphenols, which are anti-inflammatory agents. Okay, so spices, nuts, flax seeds, vegetables, tea, coffee are all important. Uh, Now, having said that, we should not overdo that because we end
Yeah.
up we end up having again a gases problem and there's
Yeah.
acidic problem, things like that if you overdo spices. Uh, Second aspect is we need to take sufficient protein for antibody production. Therefore, balanced diet needs to meet optimal protein levels. This is achieved by including one protein source at each of the meals. Each of the meals I mean to say is breakfast, lunch, and dinner. So the foods that can be included are egg, fish, non-veg, legumes, pulses, soya, which are quite rich in protein. These are very important. Each meal has to have a protein source. Having one meal with protein is not sufficient. Then only we can meet the protein levels that are required for in an individual, a normal adult. And the third aspect is including bright red, orange, and green. These are the basic colors. So red, orange, and green fruits and vegetables into our plate is a super idea. They are
Yes.
full of phytonutrients and also provide the antioxidants, fiber, and nutrients like B vitamins, calcium, and iron. So this is how you can make your meal super. So super nutrients into your super plate.
Yes, doctor. And also, many people think that if they follow healthy diet and do exercise regularly, there is no health checkup needed. What is your opinion on this, doctor?
Of course, no doubt that if one maintains a healthy diet and exercise, they'll be better off in tackling diseases. But that does not mean that they don't require health check at all. A normal person must undergo annual checks regularly. This helps in identifying health issues early and act accordingly. This is my take on this.
Okay. Thank you, doctor. So we have Dr. Rajesh Shavi with us. So, Dr. Rajesh. Okay. So, Dr. Sunil, post-COVID, many patients complain on breathlessness and chest pain. What are your health advice to these kind of patients? Do you think that they need to go for chest X-ray or CT scans or even do ECG after recovering from COVID?
Okay. So nowadays, most people are coming to OPDs with these symptoms like chest pain, mild breathlessness or exertional breathlessness and cough. And there may be nausea also, repeated vomitings, bloating sensation. So these common symptoms they are getting regularly. So many of them are coming to OPDs also nowadays. So regarding these chest pains, we have to assess whether it is related to cardiac or it is lungs or it may be gastrointestinal. So some underlying acidity may cause like these chest pains. Okay, and some in some people maybe like post-COVID pneumonia is also there, like pleuritic chest pain. We can call like this, that is pneumonia type of pain, like pricking type of pain will be there, like thoracic chest pains. Some
Okay.
people have sharp excruciating pain. So whether it may be acidic or it may be due to underlying cardiac, or it may be due to lungs. We can assess with like a ECG, basic ECG. Then we have to see the X-ray whether they have any pre-existing underlying allergic or asthmatic conditions or COPD conditions. Some people like unrecognized, they have pre-existing allergies from long years. So what happens when they have like these post-COVID viral symptoms or like lung infections, like viral infections or bacterial infections, these may get prominent. They don't know, like they from long there, these changes will be there. But at the time of this, we can see those changes like become prominent with they will be coming with mild breathlessness, coughs. So we can assess like PFTs and 6-minute walk test. How the breathing capacity, what are their lung functions like forced vital capacity, lung. So different types of parameters will be there. We will be assessing those parameters. So with that, we can see whether they're requiring bronchodilators or any inhalers. We can give. It may be take like temporary resolution will be there within 2 to 3 weeks or 6 weeks or 8 weeks.
Okay.
So it is all important. We can see it may be sometimes underlying myocarditis or myocardial ischemias, like heart related symptoms. So we in ECG we can evaluate those things. Mild like ST elevations will be there, like ECG changes. So immediately they have to go for 2D echoes or treadmill test like TMTs, and they can easily know what happening. Like immediately they can see their like heart health, and they can consult the cardiologist.
Okay.
And some
Okay.
people will be having GRDs, like recurrent GRDs with underlying obstructive sleep apneas.
Yeah.
So these people also will complaining of like more of coughs, recurrent coughs, nighttime coughs, disturbing coughs, some breathlessness. So we can evaluate with upper GI endoscopy if they have repeated GERDs, or we can use some antacids for relieving that.
Okay. Okay, doctor.
Yeah.
We have Dr. Rajesh Shavi with us. Hello, doctor. Thank you for
Hi.
joining in a very busy schedule also.
Yeah,
So, doctor, you have been treating thousands of COVID patients since first wave of pandemic. In the
yeah,
beginning of first wave, there was lot of panic among people as mortality rate was very high. And we have observed that during the third wave, the COVID positive patients as well as the deaths have are very highly reduced when compared to first and second wave. So, doctor, what kind of changes have you observed among patients' clinical conditions during these three pandemic waves?
yeah. Thank you for giving opportunity to talk in your session. First wave, what we had, usually it affected elderly individuals, more elderly, and then those who had comorbid conditions, and even the younger individuals also were affected. That time, the treatment options, I mean, like now we are not very sure, like what treatment we should put initially, like now when they got infected with the COVID, because it was very new to everyone, in fact. So there are a lot of permutation combination of drugs, but ideally, like no, whatever drug we started initially, they were not so much effective against the COVID. So morbidity and mortality were a little on higher side. So only when the remdesivir entered our Indian market, then the mortality, I mean, like no, though they say the mortality, it doesn't affect the remdesivir injection, but it did make a difference in improving the patient's condition. At the same time, I mean, like no, we also saw a lot of morbidity and mortality in first wave, and second wave again, it affected mostly little younger individuals, like between 30 and 40, and elderly individuals also were affected. Those who had comorbid conditions like diabetes, hypertension, heart diseases, especially kidney illnesses.
Yes, yes.
And hi. Second wave was caused by hello.
Yes, doctor.
Second wave was caused by Delta virus, as you know. I mean, like no, it really created havoc. I mean, like there are a lot of morbidity and mortality. I think probably it was a mutated. I mean, like and then even the remdesivir injection, remdesivir, and we had to use tocilizumab, all that in sick patients, and a lot of morbidity and mortality we saw this time in the second wave. But third wave, the Omicron, which we call, I mean, like now when we had recently just last month, the morbidity was, I mean, like not so much, and the mortality was very significantly less. Okay, probably I think the virus has become less virulent with the mutation, so that is the reason. And this time, I think most of the patients were treated on OPD basis, and there's a tablet called molnupiravir that we started in mild illnesses, and they recovered quite fast.
Yes.
Though they had I mean, like, a little amount of weakness and persisting cough and joint pains after the illness, they're all very mild. So this time it was not so bad. And hopefully, I think it should end at this point.
Yes, doctor. We are also hoping for the same.
Yeah.
So, doctor, So, doctor, why do you think even after 64% of the world population is being vaccinated for COVID, we still see some COVID positive cases among vaccinated people? Many are worried if really vaccination and booster doses are helpful in preventing COVID.
Yeah. What is happening is, see, all the vaccines which are all prepared now, I mean, like, no, they're done on the spike protein. Okay, and this spike protein with each mutation, it changes. So we have to develop a super vaccine which covers, I mean, like, all the mutations. It is at this point of time little practically impossible. Okay, to cover all the, because we don't know how the virus mutates and how the configuration of the spike protein changes. Okay, so accordingly, we'll have to prepare the vaccine, the researchers. So it's a real challenge actually. But the very fact that most of our are vaccinated, and even if we get infection with the COVID virus, it will be mild, hopefully, because we got enough antibodies to cover the spike protein. Okay, the spike protein doesn't get attached to the receptor so well, and it doesn't invade the cells, so to cause very morbid infection. That's what we hope now, and I think if they develop a super vaccine, there's nothing like it. So that's why I think we seeing that breakthrough infections in the patients who are vaccinated also.
Yes, doctor. And also, doctor, since the beginning of this pandemic, people have been avoiding these regular health checkups because of the fear of stepping outside their homes. What are the impacts on patient health? As you have been treating diabetes and other chronic condition patients for years now, please let us know if avoiding these kind of health checkups has led to the progression of complications in these patients who have these chronic conditions.
Yeah, one is, I mean, like, the lockdown itself, I mean, like, there's a lot of, I mean, like, lack of exercise, and there'll be, in between snacking will be more. Okay. And lifestyle itself becomes very unhealthy. So that will predispose to any sort of infection. So, and even they get a COVID infection also. Okay, and if they don't maintain a healthy lifestyle, like good diet and regular exercise, that's one thing. And then that itself can reduce the immunity, which can predispose to any other infection for that matter.
Okay, doctor.
So regular health checkups are important in the sense, like post-COVID also, because the incidence of diabetes is more in patients who have had a COVID infection and then who are treated, and in them also we can see diabetes emerging. So we have to have a regular health checkup, keeping in mind of this diabetes and kidney parameters and liver parameters. Okay, and a D-dimer. Okay, those things have to be monitored regularly to see that they don't go into complications.
So, doctor, when you say that regular health checkups are very important, what should be the time intervals for health checkups? Is it like once in 3 months, once in 6 months, or do you recommend once in a year?
See, if the person is less than 40 years of age, I think you're talking in terms of like post-COVID or regular health checkup, or it's just general. In
General health checkups. Yeah.
Okay. In general, I think if it is like the person is around 40 years, I recommend, I think, once a year, a regular health checkup is needed. Okay. With the focus on HbA1c, the last 3 months average sugar, and lipid profile, and the regular ECG. And in case they have any symptoms like existential chest pain or breathlessness, then they can undergo echocardiogram and treadmill test, okay, to make sure the heart is okay. Once a year is ideal. Yeah.
Okay. So even for patients with chronic conditions also, do you suggest once a year, or they should be doing at regular intervals?
Chronic conditions, they be at least once in 6 months. And if they're diabetic, you have to keep checking your HbA1c at least once in 3 months. Okay.
Yeah. Yes, doctor. So, doctor, and also for patients who have chronic conditions like diabetes, hypertension, then CKD and fatty liver, for these kind of patients, checking their health vitals like blood pressure, blood sugar, pulse, and all, is it mandatory to do it on daily basis?
I don't recommend on daily basis the pulse and all. I mean, like if it is stable, the pulse rate as well as the BP, I mean, twice a week I think should be okay. So every day checking BP, I mean, like I don't think it is necessary. Okay, twice a week should be okay.
Okay. Okay. And also, doctor, our company Qurhealth has been working on preventive care plans and diet plans. And also, as we know very well, that prevention is better than cure. So do you think preventive health checkups among healthy population can help in early diagnosis of these health issues?
Yeah, definitely. I mean, like you can get to know because usually diabetes and hypertension being silent diseases, so we don't know. I mean, like so many people, even if they don't have symptoms, I mean, like now regular preventive health checkups, we can come to know like if they have diabetes or BP, okay, even cardiac issues also sometimes. So we can get to know that, and then we can start a treatment at an early stage to prevent further complications. They are very much necessary, madam.
Yeah, thank you, doctor. So now moving to Dr. Janaki. So, doctor, many feel that because of reduced physical activity among work from home employees and study from home students, eating less food would prevent weight gain. What is your take on this, doctor?
Okay. As I said earlier, however we are working, balanced diet is the key. So having said that, we are spending less energy by being sedentary or beyond sedentary. So our diet plan will be accordingly only. But eating less food or skipping meals, we will be slowing down our metabolism, which will in turn will make us gain weight. This is actually happens in many cases. And at the end, we will be wondering why we are gaining weight, though we skipped meals. It is painful, isn't it? For people who skip meals and then again gain weight also. The basic idea is to boost the metabolism. Two things are important to boost metabolism. One is food on right time. And the second is a minimum physical activity of 30 minutes per day that raises your heart rate. This is a proven way of weight management over hundreds of years and as shown by scientific evidence also. So that's what we have to do.
So, doctor, what would be your advice on structuring the nutrition, hydration, then physical activity and sleep when we talk about this work from home and study from home population?
It's very important indeed, because the work from home causes irregularity in our life, because we are at home and we have enough time to do all things at hand, and we tend to postpone also at the same time. Remember, we have only 12 hours at hand to work, though there are 24 hours we say, But I always say 12 hours, 50% of the time only we can work, and after which our engines will slow down. So we need to take rest or will slow down. Automatically, we'll be doing less output, or productivity will be zero. So a simple and common example of how we may do things while on work from home is like one may postpone passing the ball in the morning. This is the first thing we observed being at home. Can I think that has to be muted.
Dr. Rajesh, can you please mute?
Yes. That's sure.
ECG normal is na?
1 second.
ECG.
I see now.
Normal.
Okay.
Thanks.
Oh,
So
sorry,
I'm
ma'am.
talking. No problem.
Sorry.
Okay,
No problem, sir.
Yeah.
So I was talking about a simple example, a common example which we have observed while work from home is one may postpone passing the ball in the morning. This is the first thing we observed being at home, which leads to constipation and can cause bloating, lowness of mood, gases feeling, and many other things. In fact, it will actually increase the anti-inflammatory agents in the gut system. That's why it is very important to structure our food intake, physical activity, hydration. Hydration, I mean, it is not taking a lot of water or drinking gallons of water, but along with the water, that's a normal 6 to 8 glasses of water, we also recommend having fluids in the food, like in the form of soups, in the form of juices, in the form of our very own rasam sambar, and some porridges like that. That is what we recommend as a part of hydration. And of course, we have to definitely take care of the nature calls like bowel movement and also sleep. These are very, very important.
Okay, doctor. And also, doctor, do you think like change in lifestyle, the eating trends and the fats can be one of the reason for younger age group falling prey to all kind of diseases?
Yeah, all roads really leads to that actually. So I would say absolutely. The very first thing that is happening with the next generation is exposure. Exposure to too much information, which is not important, which is not required for them, and too much tuning into information, which is also not required. The result is sleeping only after the date changes, eating junk, eating without even looking at what they are eating, taking high stress on education goals, peer and parent pressure, all these things. And as I said, all the roads lead to inflammation and causing disease conditions. So we need to really sit with them and plan things and give assurance that what is important, what is not important, that it is okay to not reach the goal as said, or it is okay to take their own time to reach the goal also. So these are the things, and also we need to educate regarding the food right from childhood, how it influences the gut, because gut is the main thing that produces the immune cells. So right from the childhood, we have to inculcate the good habits and good relationship with the food, so that they become very, they become very healthy, and also their immune system will become quite healthy. They can combat any kind of diseases. They'll be like, their innate immune system will be quite strong if we inculcate right from the childhood.
Yeah. Yes, doctor. Thank you. So, Dr. Sunil, I have a question for you. So, due to pandemic, you very well know that this work from home, study from home has become a new normal. So, this has again led to sedentary lifestyle, which is negatively impacting on the physical and mental health. So, what is your advice on improving lifestyle during pandemic, doctor?
Yeah, many of them are been neglecting their physical activity, and they're more, and the software engineers and other people they have started from working from home. So what happened, they are eating more and there is no physical activity, like they are eating junk foods, like high fatty foods, high cholesterol foods, so without doing physical activity. So for at least we have to do 30 minutes of brisk walk or any type of moderate physical activity a day for 5 days a week, and other 2 days we can do some resistant exercises. and avoiding fatty foods, which are high cholesterol foods, red meats, and who have risk factor, who have already like pre-existing risk factors like smoking, alcohol. They have to slowly they have to avoid, or slowly they have to quit these things, and they have to take adequate good amount of hydration and adequate balanced diet which rich in fibers. Okay. uh, so all these activities, like important physical activity, should be there to these people regularly.
So, and also Dr. Sunil, in recent times, we have seen that a lot of young group population, like they are reporting cases of heart attack, stroke, and developing new type of cancers. What could be the possible reason for this? Is it lifestyle changes, food that we eat, or because of pandemic, or because of the polluted environment that we presently are living in?
Yeah, it's a, there may be different types of causes will be there. See, some in some people they are more lying on like coal belts areas, or they are more prone for like pollution. There may be chances of the inhalation of some more carcinogens. There, those people may lead to lung cancers or any other occupational lung diseases. And due to obesity, nowadays obesity is also more common concern. Even young people are suffering from high BMIs, more obesities. So in those people also, there may be chances of what we say, all risk factors will be there. So in obesity people, we can see more of myocardial heart attacks, like myocardial ischemias heart attacks will be there. So reducing weight at least, like near BMI, maintaining their BMI and reducing their weight, and with regular exercises, we can prevent all these things.
Yes, yes, doctor. So what would be your advice for the youth and as well as the adult population in terms of their health, and also how to encourage them for preventive health checkups?
So regularly they have to maintain all good balanced diet, as madam has said. So regular nutrients, what should I take? So, and more of avoiding junk foods like high cholesterol diets, with other rich fatty foods, red meats. So those which in more fatty content, all those things, those diets, and maintain. And at least if they are diabetics, they have to maintain the regular health checkups, at least 3 months fasting post lunch, and HbA1c regular checkups. And if they are dyslipidemias, they can check every 6 months. They have to check the lipid profiles, uh, and concentrate on more of physical activities, any type of moderate physical activity. So, so all these can maintain their good health.
Okay, so moving to Dr. Rajesh now. So Dr. Rajesh, like we already mentioned that at Qurhealth we provide care coordination service. So what do you think, doctor? Will having a care coordinator or a healthcare assistant who will be virtually keeping a tab on health parameters of people who are suffering from chronic conditions, do you think this will be helpful in managing the health outcomes in patients with various types of issues? Maybe it is comorbid or chronic.
Yeah, no, it definitely makes a difference, because what happens, the treating doctor will not have so much of time to explain all the things to the patient. So if the care coordinator or health assistant is there, it will definitely make a difference. So I suggest it is absolutely required, especially in this post-pandemic. I mean, like especially when they're having this health issues, and they're having a very sedentary lifestyle. So care coordination is very much needed now.
So, and also, doctor, do you think that care coordination services can be of great use for elderly population or for people who have a busy schedule, like the younger population?
Both. I think you have to motivate both. Both are required, man.
Yeah.
Yeah, you require it for both elderly
Okay.
as well as the young population who are working from home. Both require the care coordination.
Okay,
So that
doctor.
will, I
Thank
think, update the diet, nutrition, as well as the healthy lifestyle. So they'll follow that.
And
Okay, doctor.
may I add to
Yes.
sir's?
Yes,
So
yes, doctor.
younger generation will have it is a complete prevention. Maybe the older generation with already any lifestyle conditions, then it will be a prevention of other complications, secondary complications.
Yes,
That
yes,
way it
doctor.
will help. It will help better.
And also, Dr. Janaki, as we see a lot of working population and students, nowadays they are under high stress. So stress has become one of the important factor for a lot of health issues among younger people. Along with stress release therapies like medication and yoga, what kind of diet will help them in combating these stress issues?
Yes, one of the keywords that frequently typed in Google is how to combat stress, ways to combat stress. So stress to some extent is good, but if it is constant and bothersome, we will take the toll. That's for sure. It causes inflammatory conditions like weight gain and central obesity, that is midsection, and diabetes, hypertension, etc. So nowadays, certain studies are even including certain cancers into stress related also. So recognizing a trigger and lowering the trigger is one first thing that individual can do. So foods like walnuts, pumpkin seeds, chamomile tea, sweetened milk, turmeric, dark chocolate, fatty fish are known to lower stress. Actually, they help in helping out the brain chemicals, that feel good chemicals. And also exercise is one of the things that actually immediately, instantly releases endorphins, which are feel good hormones. But basically, one needs to lower the stress, then become dependent on foods, because from foods the dependency may grow to alcoholism and some may do narcotics also.
Yeah.
So therefore, food comes as a supportive agent, not as a curative thing. So it has to support the already people who are facing the stress. They have to find out other ways and means to combat. First of all, they have to recognize the trigger which is causing the stress. That they have to lower. Then they can take all these foods, and it will definitely help and maintain, and the issues can be resolved.
Yeah, thank you, doctor. So we are now moving towards our Q&A session from our viewers. Dr. Isha, our marketing and communication leader at Qurhealth, she will be taking up this Q&A session. Dr. Isha, over to you.
Thank you, Dr. Jamuna, and thanks, Doctor. This was a very insightful session, I will say, and I think so. Our viewers are very excited, and we are getting too many questions now. So I will just ask some of the questions before we, end our session. One of the viewer would like to know that I am a diabetic patient in my 40s. What are my risk factor for other diseases, and how can I take steps to make my health better? I think so, Dr. Rajesh, you can help us in this answering this question.
Yeah. You can maintain a healthy lifestyle, diet and exercise, keep the sugars under check, keep the HbA1c around 7%, and you have to. Or what is the other part of the question? I didn't get it.
Yeah, that he's in his 40s and a diabetic patient, and
what
what are
complications
his
he can
risk
expect?
factors?
Yeah.
Yeah.
Okay. So if he maintains the sugar around 7% of HbA1c, I think he should get into any complications. There are so many complications of diabetes, like you have a diabetic retinopathy, and you have a cardiac elements like ischemic heart disease and the stroke and diabetic neuropathy and diabetic nephropathy also. So you have to keep a check on all those things. Once a year, if we can do a 2D echo and TMT, that will take care of the heart issues. And then if he keeps checking the microalbuminuria, if there's any albumin excretion in the urine, so that you can keep a check on the nephropathy. And the regular fundus examination at least once a year. So that will prevent diabetic retinopathy. Okay, those things. And if he maintains a healthy lifestyle and if he's regular with his medicines and keep a HbA1c around 7%, I think he shouldn't get into any complications. Yeah.
Thanks, doctor. I think so. One more question that we are, frequently getting, that there are labs who are providing the bundled health check packages to them that they can, go and get it. So do they always need a doctor's consultation for that, or they can randomly get their, such blood test done?
Yeah, you can get the blood test done and then see the doctor later with the reports. No issues, nothing.
Okay, thanks. So, Dr. Janki, one of the question that we are getting from the users are, what should be the motivation to keep, having a healthy diet, to keep going with a healthy diet? Because I think so many of the viewers, they may start with their, their month that we will eat healthy, but I think so somewhere, someplace they, lose that motivation. So that is one of the question that one of the user has posted. So what do you think?
Okay, I'll tell what I actually practice with my clients. There are two things. Number one is motivation we have to have from self. Somebody cannot motivate us to do our own thing. So we have to motivate ourselves. That for that we have to know the current picture and how you want to see yourself. Maybe it can be a film actor or actress, or the shape or the size or the muscles, whatever you want to, whatever you want to become. That picture also you keep on both. I mean, side by side. Then you will, then they will be motivated. Or at least for 1 week they keep seeing the picture, and at least in the second week they start doing what they have to do, the act of it. And other thing which I regularly do with my clients is 5 days of week they have to be on a particular diet, like whatever we recommend they have to be on that. And remaining 2 days they can be free of diet, in the sense they need not think about what they are doing, I mean what they're eating actually. But at the same time I ask them to do some exercise or something, physical activity which is not being done during these days, these 5 days, the entire week. So entire week is a routine, like 5 days is a routine. Next 2 days will be like end weekend, and everybody wants to enjoy and things like that. So you enjoy your food, also you enjoy some different exercise, like trekking, long walks into woods, or going swimming, or at least you can also do the window shopping in big malls. So take a round of all floors, go by walk. These kind of things I keep telling them, so that they won't lose on the things. They think that if you are on diet, that you are losing on things. So that kind of motivation we have to give to the client, so that they stick to what we say.
That's great. I think so. We are also taking the notes now. We are also
Thank you.
following what you just advised, I think so. So thanks a
Thank
lot,
you.
doctor.
Thank you.
So the next question that we are getting, I think so, Dr. Sunil, you will be the best person to answer this. One of the user has a question that he has been a smoker most of his life, and he has a family history of cancer. So what are the preventive steps that he can take? Because I think so most of the things are pointed towards a risk factor.
Yeah, okay. So if actually smoking is a risk factor definitely for lung malignancies, lung cancers, but all those smokers who will be smoking not getting lung cancers. So for that they have to regularly screen their lungs with chest X-rays or CT scans. So already there is strong family history. So some types of markers also will be there, like those we have to see whether this family is suffering from what type of cancers. So for that we can have some specific markers relating that. So we can do some markers if they are high risk people, and at least we have to monitor him after, if the people like more than 30 to 40 years of smoking history, at least 2 packs a day, there may be chances of their lung carcinomas. So they have to regularly, after 20-30 years, they have to monitor with HRCT, like CT chest or chest X-ray, to identify any lung masses. So, and try to avoid smoking, like quit smoking. That's a better thing.
Yeah, I think so. That is the most important thing that he can take away from this answer. So as we are nearing towards the end of our session, there is one more question that the person is asking, that where should we get these, we are talking about preventive health checks, where should we get this done? So I think so I can answer this. At CureBook, we do have such preventive health check plans that are readily available. And as all the doctors have, advised how important these preventive health checks are in keeping your health checked and keeping everything under control. So these tests you can certainly get down to CureBook and just look into it and get all these doctors prescribed and curated design tests that are there to make sure your health parameters are taken under control and undertaken under care. So do visit CureBook here. And over to you, Dr. Jamuna.
Thank you, Dr. Isha. Thank you very much, doctors, for sharing your valuable thoughts with our audience in this webinar. This has really helped us in understanding how important regular health checkups are for all age group peoples, and also very important during this pandemic situation. And to the viewers, I would like to explain that to avail the benefits of our care plans and diet plans, along with our care coordination service, please download our QR Book app from Play Store. So you have to just type QURBOOK. This is freely available in Play Store. Anybody can download it. We will be very happy to serve you and your healthcare needs. Thank you all for joining today's session. Thank you very much, doctors. And also, please stay safe and stay healthy. Have a great day. Bye-bye.
Thank you.
Thank you.
Thank you.
Thank you.
Bye.